Bismillahirrahmanirrahim. Hadith of the day. Allah's Messenger sallallahu alaihi wasallam said, Truthfulness lead to righteousness, and righteousness lead to paradise, and a man keeps on telling the truth until he becomes a truthful man. Assalamu alaikum everyone. My name is Dr. Marina Akhtar, PGR Community Medicine. I am presenting the topic Epidemiology and Public Policy under kind supervision of my professor Dr. Saira Afzal. Learning outlines, introduction to epidemiology, objectives, techniques, application, and its importance. Public policy, its purpose, cycle, aims, feature, types, phases, analysis, evaluation, healthcare policies, recent updates, and MCQs. Learning outcomes. At the end of this presentation, participants would be able to describe epidemiology and public policy in details and its significance. Epidemiology. Epidemiology is the study of distribution and determinants of health-related states or events in the specified population and the application of this study to the control of health problems. Objective of epidemiology: to identify the etiology or the cause of disease and to determine the extent of disease, to study the progression of disease, and to evaluate preventive and therapeutic measures for a disease or condition. Epidemiological techniques. The three major epidemiologic techniques are descriptive, analytic, and experimental. Although all three can be used in investigating the occurrence of disease, the method used most is descriptive epidemiology. Major task of epidemiology in the public health practices. In the mid-1980s, 5 major tasks of epidemiology in public health practice were identified. Number 1, public health surveillance. Number 2, field investigation. Number 3, analytic studies. Number 4, evaluation. And number 5, policy development. Common practical application of epidemiology. It includes investigation of infectious disease, and these are done on routine basis, are conducted by health department to investigate common infectious diseases, particularly foodborne illness and foodborne disease. Importance of epidemiology. The importance of epidemiology cannot be overstated. Epidemiology saves lives and improve global long-term health. The aim of epidemiology are to prevent and reverse negative health outcomes, and the uses of epidemiology are most important for communities that experience a lot of poverty and instability. Disease detectives. When disease outbreaks or other threats emerge, epidemiologists are on the scene to investigate, often called disease detectives. Epidemiology and the public policy. The role of epidemiology is to regularly improving understanding and identifying problems and risks. Public health practice and public policy are about applying what is known and possible. Public policy. Public policy, a course of action developed, adopted, and pursued by a government that may be local, regional, national, or supranational, and implemented and enforced by its agencies in order to address an issue of the public interest. Public policy seeks to achieve certain aims and objectives by setting out a strategy and associated tasks along with the means of evaluating success. Public policy can be generally defined as a system of laws, regulatory measures, course of action, funding priorities concerning a given topic promulgated by governmental entity or its representative. This picture showing the hierarchy for the purpose of hierarchy for the hierarchy of main policy, purpose of policy. Policies are the distillation of everything above them in the hierarchy: mission, value, strategic objective, along with the law. Policies articulate goals that are narrower than strategic objectives and identify limits or boundaries for behavior and action that are necessary to complete those goals. Public policy cycle. The process of public policy cycle has a number of stages which interact in a dynamic fashion that includes identification and information, identification of the problem, information gathering, decision making, implementation of the policy, and the evaluation, termination, and renewal. Characteristic of the public policy. Characteristic of the public policy includes it outlines a pattern of solving a particular problem. It is a goal oriented. It is a response by political system to the challenge and problem arising from the government. It is usually formulated by the government authorities. Type of public policy. There are four main types of the public policy includes regulatory policy, constituent policy, distributive policy, and redistributive policy. Public policy and its features. Public policy and its features include number one is goal oriented. Number two, result of government action. Number three, can take various forms. Number four, depict concern of the government. Aim of the public policy. The important role of the public policy is to make the society to lead a better life and maintain the delivery of the goods and services are significant. It regarded as a mechanism for developing economic social system, a procedure for determining the future, and so on. Advantages of the public policy. Effective public policy will support democratic institutions and processes, serve justice, encourage empathetic and active citizenship, and solve problems efficiently and effectively without causing a political rift. Sources. Public policies are influenced by the variety of factors, including public opinion, economic condition, new scientific finding, technological changes, interest group, NGO, business lobbying, and political activity. Type of policies. There are four types of policy that includes public policy, organizational policy, functional policy, and specific policy. Phases of the public policy. The public policy process in simplified form can be understood as a sequence of the four phases: agenda setting, formulation, implementation, and evaluation. This is the this picture showing a policy cycle where is which includes strategic thinking, development of the policy, implement policy change, maintaining policy, and the cycle include the further steps. Policy analysis. Policy analysis, the process of identifying potential policy options that could address your problem and then comparing those options to choose the most effective, efficient, and feasible one. Evaluation. Public policy evaluation is one of the most interesting and eye-opening way to examine the impact of the government policy. Elected official, policymakers, community leaders, bureaucrats, and the public want to know what policies work and what policies don't. The purpose of evaluation is to determine whether a implemented program is doing what is supposed to. Example of policy. The term may be applied to government, public sector organizations, and the groups as well as individual presidential executive orders, corporate privacy policies, and parliamentary rule of orders are all example of the policy. Policy differ from rule or law. Example of health-related policy includes: number one, policy prohibiting tobacco and alcohol use at the workplace. Number two, policies requiring healthy food to served at the company meeting and events. Number three, policies allowing for flex time to exercise or attend health programs. Healthcare policy example includes patient care policies, drug policies, security and privacy policies, and employee health policies. Good public policy. Good public policy seeks to define issues and implement the strategies that will produce a measurable and positive result for the general public. Health in all policies, many areas of the public policies can impact health, and health can impact many different policy goals. Healthy people will do their task in better way. Healthcare policy on the federal level, elected and appointed officials write healthcare policy with input from other professionals. Like other public policy decisions, healthcare policy on the federal level is traditionally made through three branches of the government. The judicial branch interpret the policy. Public health policy is crucial because it brings the theory research of the public health into the practical world. Public health policies create action from research and find widespread solution to the previously identified problems. Health policy. Public health. Public health promotes the welfare of the entire population, ensure its security and protects it from the spread of infectious disease and environmental hazards, and help to ensure access to the safe and quality care to benefit the population. Public health policy. Public health policy is defined as the laws, regulation, actions, and decision implemented within society in order to promote wellness and ensure the specific health goals are met. Public health policies can range from formal legislation to community outreach efforts. Healthcare policy. Healthcare policy is important because it helps to establish guidelines that benefit patient, healthcare organization, and our healthcare care system. Having protocol in the place can help to prevent human error and the poor communication around medical decision. Objective of the public health policy. The overall objective for the public health policy is to create the condition for good and equitable health among the entire population and to and avoidable health inequalities within a generation. Analysis of the public health. Analysis is important for public health policies for several reasons. This phase gives public health professionals and other stakeholders the opportunity to more deeply research and strategize around the potential solution to the issue. Public policy affects society. Public policies at the local level, such as tax structure, budgeting, and employment regulation, directly affect the economic prosperity of the community. Effective cooperation among the government and private sector leaders can generate economic development that moves community forward. 5 ways of the public policy impacts health. That include creation and regulation of the public goods and regulation of the natural resources, requirements and mandates to protect citizens, direct support and creation of the opportunities and incentives. Primary objectives of the public health and epidemiology. Primary objective includes preventing epidemic and the spread of the disease. Number 2 is preventing injuries. Number 3, promoting and encouraging healthy behavior. And number 4 is protecting against the environmental hazards. Research used for effective public health policies. Health services researchers can influence policy making in 4 ways. Number 1, they can identify critical problems. Number 2, research the benefit and the harm of the policy solutions. Number 3, estimate the cost and consequences of the policy proposals. Number 4, actively participate in the policy process to aid the real-time decision making. Top 10 public health challenges. That include alcohol-related harms, food safety, healthcare-associated infections, heart disease and stroke, HIV, motor vehicle injuries, nutrition, physical activity and obesity, prescription drug overdose. Policy issues regarding risk. Public policy is developed through the process of legislation and regulation. Litigation has become an important instrument for developing and implementing public policy. Certain major societal issues must be considered in making decisions about the risk are following. Number one, what percentage of population should be protected by the policy and what level of risk is society willing to tolerate? Number three, what level of control of risk is society willing to pay for? Number four, who should make decision about the risk? Policy making require a balance between what can be done and what should be done. Now coming to the recent updates. According to CDC, what is legal epidemiology? Legal epidemiology is the study of law as a factor in the cause, distribution, prevention of the disease and injury. It applies a rigorous scientific method to translate complex legal language into data that can be used to evaluate how law affect population health. How legal epidemiology connected to the public health? Law and the public health are intricately linked together, shaping how people interact and experience the world around them. Laws can provide the foundation to help public health action occur. A growing body of evidence demonstrates legal epidemiology's potential to drive changes in the condition where people live, work, and play. Who uses and benefits from the legal epidemiology? Legal epidemiology is a field that unites public health lawyers, researchers, and the practitioner in a common pursuit to inform public health decision making that affect which law work or whom and in what context. Chronic and non-communicable health conditions continue to drive morbidity and mortality in community across the US, posing a significant threat to the nation's physical and economic health. Public health practitioners use legal epidemiology to examine the direct and indirect effect of the law on the population at risk of the chronic health condition, thereby providing a powerful tool to gain insight and pursue more effective, equitable public health strategies. Our first article is identification of the policy priorities to address the burden of the smokeless tobacco in Pakistan, multi-method analysis. We assess the magnitude of the smokeless tobacco (ST) use in Pakistan and identified policy gaps to help ascertain short, medium, and long-term priorities. We then elicited stakeholders' views as to which these identified priorities are the most important. Smokeless tobacco control in Pakistan should focus on four key policy instruments: legislation, education, fiscal policies, and quit sport. More research into the effectiveness of such policy is also needed. Implications. A number of opportunities to improve smokeless tobacco regulation in Pakistan were identified. Among these immediate priorities include smokeless tobacco sale to and by minors and mobilizing advocacy campaign and introduction of licensing through 1958 Tobacco Vendor Act and levying taxes on smokeless tobacco and standardizing smokeless tobacco packaging. Second article is an analysis of the impact of the newborn survival policies in Pakistan using a policy triangle framework. Pakistan's high rate of the newborn mortality could be associated with the lack of the clear, inclusive, and objective policy making process and a failure to formulate a comprehensive and clear policy. An evaluation of the previous and existent policy relevant to the newborn survival in the Pakistan uncovers several weaknesses reflected in poor implication of these policies. Any future health policy making with the focus on improving newborn survival in Pakistan or other similar situation may benefit from the translation of evidence, clear target setting, and decentralization of the child health care service. Now coming to our MCQ session. First MCQ is During a cholera outbreak, epidemiologists identify contaminated water source as a primary cause and recommend boiling water as an immediate measure. What is the main importance of epidemiology in this case? Option A, enhance the public awareness of the disease. Option B, provide real-time data for policy formulation. Option C, prevent disease outbreaks through timely interventions. Number D, promote investment in water infrastructure. Option E, encourage the use of modern technology.
D.
C is the right answer. MCQ number 2 is a city council approves a ban on smoking in the public spaces. To enforce the policy, no smoking signs are placed, and fines for violators are introduced. Which stage of public policy cycle is this? Option A, policy adaptation. Option B, policy implementation. Option C, policy evaluation. Option D, agenda setting. And option E, policy formulation.
D.
D.
Answer is option A. Sorry, answer is option B, policy implementation. A Samal community reports an outbreak of the gastroenteritis with the 50% of cases linked to drink water from a local well. As a public health officer, what is the first step in controlling the outbreak? Option A, issue a public advisory to avoid the well water. Option B, initiate mass antibiotic distribution. Option C, investigate other possible sources of infection. Option D, begin chlorination of the local water supply. Option E, conduct a health education and campaign on sanitation.
D.
Answer is option A, issue a public advisory to avoid the well water. MCQ number 4 is a network of the group and individual that see major social and political changes who act outside the established political institution is commonly referred as all social movement, policy communities, social movement, public interest group, and new social movement. Answer is option C. MCQ number 5 is a city experiences frequent flooding due to the poor drainage impacting public health and the economy. Citizens and the local organization petition the government to address the issue. The stage of this public policy cycle is this. What the stage of this public policy cycle is this? Option A, agenda setting. Option B, policy formulation. Option C, problem identification. Option D, policy evaluation. Option E, policy implementation.
A, agenda setting.
D.
No, this is the problem identification. The option C. MCQ number 6 is after 5 years of enforcing a sugar tax policy, researchers analyze the data to assess its impact on reducing diabetes and obesity rate. What stage of public policy cycle is this? Option A, policy adaptation. Option B, policy evaluation. Option C, policy formulation. Option D, policy implementation. And option E, problem identification.
B.
B.
Yes,
B.
Answer is B, policy evaluation. MCQ number 7 is our government plans to offer free maternal and healthcare service to the rural population where maternal mortality is significantly high than the urban areas. What is the primary objective of this public health policy? Option A, promote universal healthcare coverage. Option B, improve healthcare infrastructure. Option C, reduce health inequality. Option D, enhance disease surveillance. Option E, boost economic productivity.
C.
Yes, C is the right answer. Reduce health inequities. MCQ number 8 is a public policy enforces occupational health and safety regulation in industries prone to workplace accident. What is the key advantage of this policy? Option A, increase employee satisfaction. Option B, improve employer-employee relationship. Option C, reduce workplace injuries and deaths. Option D, enhances training for the industrial workers. Option E, boost industrial automation.
C.
Yes, C is the right answer. MCQ number 9 is a national-wide policy is introduced to ban advertisement for sugary beverages and fast food during the children's TV programming. What is the primary objective of this policy? Option A, improve mental health in children. Option B, promote healthy dietary practices. Option C, regulate advertising standards. Option D, boost local food industry. Option E, encourage media literacy.
B.
Option B is the right answer. MCQ number 10 is the government enact strict regulations to reduce air pollution by imposing higher taxes on industries emitting harmful pollutants. What is the primary public health objective of this policy? Option A, increase government um, revenue. Option B, improve environmental sustainability. Option C, reduce respiratory and cardiovascular disease. And option D, promote the use of renewable energy. Option E, boost industrial innovation. Answer is option C. This is the key of MCQs, and these are references of my presentation. And this is the YouTube link of our channel where all presentations are uploaded. Kindly like and subscribe, and thank you.
Thank you very much, Dr. Marina. This is a very nice presentation. As far as the content is concerned, the content has been chosen very carefully, along with the picture and text that matches each other. The quality of the picture is excellent. You have shown a lot of good information in your slides, and you have presented that important aspect of policy that is lacking in our province, especially in Punjab. You have chosen the policies like promotion of the healthy food, promotion of the environmental health to decrease the hazards that are affecting us in long term by causing diseases. And you have also shown the policies that can help to promote health and prolong life. Overall, it is a very good presentation, and I want everyone to please make your slides as attractive as you can and should bring the information from different sources along with references and make it a point that all the pictures should match with the text. Another important point that I want to highlight is I was talking to the undergraduate students about the different important aspects for the examination point of view. As you all know that the examination would start and there is a Viva in January. We would also like to have the postgraduate mock examination in January, where all the examiners that are in community medicine from all over Pakistan, they would be invited in the department, and many of them has already consented, especially from Rawalpindi, Lahore, and from the nearby cities. They would be here, but I would like some to join on Zoom too, so that our students would get the maximum interaction with other examiners, supervisors, and of all these format of examination like OSPI, Viva, MEMPhil, MD, MPH, as well as FCPS examination. However, I would like each and every student, please contact today your student of fourth year and tell them two important things. Number first, they should read the course of community medicine thoroughly because the paper is very, very difficult. Second, they should go through the